WHO recommends 5 key movements for hand hygiene. The 5 movements are: before and after touching a patient, before a clean or aseptic procedure, after body fluid exposure risk, before and after consumption of food, after using the washroom. Key note is, always perform hand hygiene regardless of gloves use. Wash them with soap if hands are visibly soiled. Otherwise, use alcohol-based scrub. Hope this clarifies. I am now going to demonstrate how to use the hand hygiene audit checklist. Now, your infection control nurse or any team member of infection control committee should conduct this. In ophthalmic setup, there are normally 2 main areas where a hand wash is required. The first one is OPD and the second one is your operation theater. Normally, when somebody is conducting the audit of hand wash compliance, let the top management be aware about it. However, people shouldn't be aware. It should be a surprise audit. In this column, you put the date when the audit was conducted. This is a department which that person belongs to the one auditee and not the auditor. Observer's name, the one who is conducting the audit. Then you can write here the staff category. It could be a nurse, it could be a receptionist, it could be a optometrist, so on and so forth. You can also write the name here. Hand hygiene movement. There are 5 movements as we seen earlier, before and after touching a patient, vagera, vagera. I am not elaborating here because it's just explained a couple of minutes back. Then opportunity. Now opportunity is, as I said, how many movements were there for that person where he should have washed he or she would have washed the hands. Now suppose there are 10 opportunities. So you can write here 10 opportunities were there. However, only in 3 opportunities person conducted hand hygiene. Then here will be the method, whether it is a soap or alcohol rub. In this column you should write yes or no, whether correct techniques were used. That means 5 steps, 3 steps, 7 steps, whatever are there, whether exactly it was followed or not. The hands were dried properly or not. And other things which are the techniques of hand hygiene, they are being adhered or not. Yes or no will be there. And this will be a remark column. Now once when you do this for a couple of people, this is a summary sheet where suppose there are opportunities, total of opportunities 100 and the compliance is 70. That means the overall compliance is 70% of the hospital, which is a good figure. Initially we'll target 60, but eventually we'll have to go to 85, 90. Now just this column is a software driven. Like I'll show you. Now suppose the total compliance was 20. You will observe that this figure has become red and 20. That means it is not acceptable. So either you will have to give training or do something or be strict with people, ensure that they wash hands in appropriateness. Maybe you have to tighten up supervision at a particular place till they routinely follow up the hand hygiene. Now I'm assuming it's 65 and then since I have put it at 60, it will not show in red. It is the acceptable limit. So like this, if you conduct hand hygiene, this has to be done initially once in 6 months and subsequently you can do it annually.